Welcome, everybody, to the Mental Health Association of Maryland's 2022 legislative briefing. Thank you so much for joining us this afternoon. We are so excited for the overwhelming interest and support from people all across Maryland. We are bummed, of course, that we can't be with everyone in person again this year, but excited about the opportunity that this virtual format allows us to broaden participation. We have nearly 1,000 people registered for this event, which is amazing. And so I assume people will continue to log on as we keep going on, but we're going to get started now just to be respectful of everybody's time. We wanted to start at 3 o'clock. So for those who don't know me, my name is Dan Martin. I am the Senior Director of Public Policy for the Mental Health Association of Maryland, and I will be your host and MC for the day. And so I want to start off with just some thanks. Thank you so much to all of our sponsors, to the organizations who sponsored us, and to the many folks who gave individual donations to support this event. Thanks to all of our speakers that we'll be hearing from in a little bit. Thanks to the Mental Health Association of Maryland Board for your support, and to our amazing staff who spent so much time putting all of this together. And again, thank you all for being here. Just a few logistical details before we get started today. The chat function is open for you to communicate and share with others during the event. If you have a question, please leave it in the chat. We will do our best to answer some questions throughout the briefing, but we do have a tight schedule. And if we can't get to your question today, we will follow up after the event with some answers in an email with an evaluation survey. Speaking of the evaluation survey, you don't need to wait until after the event to fill it out. There's a link to the survey right on the event homepage. But whether you do it now or wait until after today's briefing, please take a moment and complete the survey. The feedback will really be helpful in our planning future events. And while you're there on the event page, take a look around. We have a lot of information there. You can view the agenda for today. You can see our sponsors. You can access bill information and other resources. And you can help us congratulate today's awardees using our kudos boards. So please go ahead and do that. Help us congratulate today's awardees. So let's get on with it. We have a packed agenda for today. We will start with our Champions of Today award ceremony. We'll be honoring 3 individuals whose leadership has had a lasting and profound impact on Maryland's behavioral health system and the people that it serves. After the award ceremony, we'll move into the legislative and policy portion of the briefing. We'll hear from leadership at the state's Behavioral Health Administration about the initiatives underway there. We have a number of senators and delegates who will talk about bills they're sponsoring that have been prioritized by MHAMD and our coalition partners. And because 2022 is an election year, we'll hear throughout the briefing from candidates for governor who will say just a few words about their priorities and about what behavioral health means to them. At the end, we will wrap it all up with some final thoughts, next steps, and things that you can do to help us advocate to expand access to high quality mental health and substance use services for all Marylanders. So without further ado, let's get to it. It is my pleasure to turn things over now to my boss, the CEO of the Mental Health Association of Maryland, Linda Raines, who will kick off our award ceremony.
Thank you, Dan, and good afternoon, everyone. I'm Linda Raines, CEO of the Mental Health Association of Maryland. A warm welcome of appreciation to all of you here in record numbers this afternoon for our annual legislative briefing. We're living in a time when we seem to have an abundance of problems and worries, and it's heartening that so many of you are here today. People whose lives have been touched in some way by mental health and substance use concerns, folks who spend their days providing care, advocates, policymakers, government leaders. It feels good to be in a room with so many people who are making a difference, something to be grateful for, to feel happy about, and to feel hopeful about. And it's in that spirit that we present our awards each year, recognizing a few among us who are representative of the whole of this wonderful community. It's fitting that we start today with an award focused on children whose young lives have been impacted in ways that seemed unimaginable not so long ago. We present the Paula Hamburger Child Advocacy Award each year in honor of a leader who blazed the path fearlessly with unyielding passion for half a century to make sure that children and youth living with mental health needs were given every opportunity to heal, to grow, and to make their mark on this world. Many in this room have followed in Paula's tireless footsteps, and today, the Mental Health Association is honored to recognize Michelle Zabel with this year's award. I'm so happy to have two nationally recognized child advocacy leaders here today to join me in recognizing Michelle for her tremendous leadership and passion in supporting children and families here in Maryland and across this nation. A warm welcome to our friend, fellow advocate, and longtime SAMHSA leader, Gary Blau, here to share a few words about Michelle.
Thank you, Linda, and greetings, everyone. I'm Gary Blau, Senior Advisor for Children, Youth, and Families at SAMHSA, and Emeritus Executive Director of the Hackett Center for Mental Health, and a Senior Fellow for Children's Mental Health for the Meadows Mental Health Policy Institute. I'm honored to be part of today's ceremony where we celebrate Michelle Zabel for her leadership and her work to improve mental health in Maryland and across the country. Michelle is one of those rare individuals who has worked at every level of the system to improve the lives of children, youth, and families. She has made an impact in local communities, at the state level, and ultimately at the national level, where her work has improved lives all over the country. Michelle was one of the early adopters and implementers of the system of care approach, creating coordinated networks of community-based services, focusing on the importance of cultural and linguistic competence, and putting youth and families at the forefront of change. First in Pennsylvania, and then in New Jersey, which was the first state to take the system of care approach to scale. The innovations she helped to design and implement informed these statewide efforts and laid the groundwork for national implementation. Now, I got to know Michelle when she took over the leadership of the Institute for Innovation and Implementation at the University of Maryland, Baltimore School of Social Work. And in the time I've known her, I've witnessed just how much she has helped to improve the field of child, youth, and family mental health. In her role as technical assistance provider, she is always helping me in my role at SAMHSA, helping state and local leaders and providers, and helping youth and families. Michelle has built an infrastructure to support wide-scale implementation of systems of care with a very intentional approach that was and continues to be bringing together the best leaders and thinkers and making them widely available to support best practices in Maryland and across the country. It's fitting that she brought together innovation and implementation in the mission and name of the Institute, and her leadership has moved the field forward in many areas, from wraparound services to financing strategies to improving the juvenile justice and child welfare systems. Michelle has always been at the forefront of innovation and implementation. And how lucky for Maryland that this amazing resource is right here in the state I called home for nearly 16 years. Given the current and urgent need for mental, emotional, and behavioral health supports for youth and their families, this vital resource stands out as a beacon for hope and reform. It's noteworthy to highlight that Michelle's work remains grounded in systems of care values and principles and reflects a commitment to collaboration, diversity, and family and youth-driven care. She has always had a knack for identifying current issues that need to be addressed and leads the way by convening key partners, studying issues to inform responses, and developing resources to support the field. Michelle's dynamic leadership and vision have earned her much recognition and respect in the field, and we applaud her transformative work at the local, state, and national levels. I am immensely proud of her accomplishments. I'm proud that I get to work with her, and I'm proud to call her friend. She really is a true visionary in the field. And with that, I will pass it on to Jane Walker for more remarks as we congratulate Michelle on this well-deserved award. Thank you so much.
Good afternoon. My name is Jane Walker, and I am on the board of the Mental Health Association of Maryland. I had the privilege of knowing Paula Hamburger. She was a passionate advocate for children. She was steadfast in her values, strategic in her thinking, and she was feisty, not afraid to take on the system. Well, today's recipient of the Paula Hamburger Children's Advocacy Award is Michelle Zabel. And Paula Hamburger and Michelle Zabel would have been kindred spirits, as Michelle has the same passion for children and the same qualities that Paula had, and many more. Michelle came to Maryland in 2005 with her husband, Andy, and her two young children, Quinn and Xander. She came with a wealth of experience from her work in New Jersey and Pennsylvania. She was hired by the University of Maryland part-time to lead the Innovations Institute. She has grown the Institute from one part-time position to over 100 staff members who are each experts in their field. Michelle and her staff have garnered millions of new dollars for the state. And as Gary Blau mentioned, she has put the Institute on the map as one of the national centers of excellence across the country. While much could be said about the services, training, evaluation, and research that Michelle has fostered, there really, for me, are two major points that stand out. The first is Michelle's commitment to partnering with families. The second day that Michelle arrived at the Institute, she called me on the phone, as I was the director of the Maryland Coalition of Families at the time. And she said, "You're the first contract I'm writing. We're partners, right? I need families to get the work done." Michelle did write that contract, and she has had the voices of families and youth at the table every step of the way. The second point about Michelle is that she has made children's mental health a cross-system issue. We know that our children with mental health needs are in every child-serving system, child welfare, juvenile justice, education, and Michelle and her staff have infused their expertise, values, and research into all these child-serving systems as well. Michelle is adamant that we need to invest in families. Instead of blaming them for doing something wrong, we need to give them support, services, and tools to change their trajectory for their children and their families. Michelle lives by those words in everything she does. It is my privilege and honor to present Michelle Zabel, my colleague, my mentor, my friend, with the 2022 Paula Hamburger Child Advocacy Award. Please join me in celebrating Michelle Zabel.
Thank you, Jane Walker. Thank you, Gary. Thank you, Linda. And thank you to the Maryland Mental Health Association. I am truly honored and humbled to receive this award. I'm grateful to be recognized alongside Paula Hamburger and the amazing recipients that have received this award in past years. I also want to thank all of you who have gone to that kudos board or messaged me or sent me a GIF or a text. And I clearly can't move forward without stopping and acknowledging the amazing team at the Institute, as well as all of our national, state, and local partners. Honestly, it's just a joy to work with all of you as we challenge the status quo and try and make change happen. So for anyone who knows me, you know that I love that Jane inferred that I was feisty, and also that Gary acknowledged that I was part of the early adopters of system of care. So truth be told, I'm actually old enough that I would consider myself a CAS baby, a child adolescent service system baby, a pre-system of care professional, back when we were still trying to start conversations about why children's services and systems needed to look different than adult services, why families even should be at the table. We weren't even talking about youth voice then. I started in the field when it was normal and accepted for families to relinquish custody of their child to the child welfare system just because that child needed mental health supports. I started my career as a residential treatment worker and a child welfare case manager. Those experiences have never left me. I've spent my entire career trying to move our system so that we prioritize children and families sooner, that we structure systems so they make sense, and that we finance service and systems so that providers are able to provide high quality, effective interventions sustainable over time. I hold myself and the Institute's 110 employees to a standard that we can and we should always be doing better. Because when we know better, we should do better. Over the past 30 plus years, I've witnessed us create and expand home and community-based services, including field-driven models and evidence-based practices. We've stood up strong family and youth organizations with the structural capacity to partner at the local, state, and federal levels, and a level of innovation that honestly, I would never have imagined. That said, there's no way I can accept this award and talk about how far we've come without acknowledging the multiple crises facing children, youth, and families today. The behavioral health needs of youth and young adults are increasing. Our public and our private sectors are buckling under the weight of the pandemic pressures combined with complex needs. Systems of oppression and racism are ever present. These challenges exacerbate each other and can leave us depleted, exhausted, and feeling hopeless. So today, I call on each and every one of us to keep with it. Don't give up, pay attention, stay involved, step back when you need to, and then return to the table to help us to continue to do things differently, to do things better. This year, we have an amazing opportunity on the horizon. Our field will be standing up a 988 national call line, and crisis response systems will be developed in every state. So we know that children, youth, young adults, and their families need a comprehensive crisis system that's customized to meet their needs. We cannot afford to have that system replicate the adult system. We need to design, finance, install, and support a system that truly responds to families. As Maryland organizes this effort, I ask that all of you pay attention, stay informed, engage. We need to ensure that this crisis continuum allows families to define their own crisis, ensures family caregivers, youth, and young adults have someone to call or text, someone to respond when and where they are needed, and ultimately that they have a system to support them after the initial crisis has abated. A system that includes a family in the development of system and solution-focused goals. This agenda alone has the potential to be a game changer in every state. And so we need to stay vigilant so that it's done correctly. Every day, we have to wake up committed to making our own difference in this system in Maryland. We must work to help children and families be successful in their own homes and communities. And we must bring services and supports to them in trauma-informed, culturally responsive ways and use science, data, and technology to improve lives. So thank you to the many advocates for children, youth, and families in Maryland. I especially want to thank the Maryland Coalition of Families and Honor OWN of Maryland for the role they play in our systems, ensuring family and youth voice with lived experience are elevated and integrated into the work we do. Thank you again for this award. As I wrap up, I want to publicly commit to continuing to advocate and make change happen. And I look forward to continuing on this journey with you. Thank you.
Congratulations, Michelle. Thank you for being as feisty as Paula Hamburger. And thank you also, Gary and Jane, for joining in this celebration of Michelle. Our Distinguished Service Award recognizes career-long leadership, service, and lasting impact on the lives of individuals with mental health and substance use conditions. In the case of this year's recipient, Cynthia Petty, I will add to that list kindness, determination, and true generosity of spirit. Here too, we have several individuals joining us to share a few words. But before they do, I want to say a few things about Cynthia as a person and the grace with which she has walked among us in her many years in the field. Someone who was always willing to help, someone you could always count on, no matter how busy she was. Someone who embodied consumer empowerment in her work, a kind person, and a person that many of us miss in our daily lives since her retirement. I think back to her last few years at the Behavioral Health Administration and how understaffed the agency has been with many retirements and departures. Cynthia increasingly became the person I called for help because she knew everything. Sometimes she sounded so exhausted that I would tell her not to worry about my little issue. Being Cynthia, she would always find some way to do it anyway. We have Mike Finkel with us this afternoon, who we recognized with this award last year, to share remarks about Cynthia. Welcome, Mike.
It is a great honor and a pleasure to have been invited to say a few remarks about Cynthia Petty. For those who may not know me, I was the founder and the original executive director of Honor OWN of Maryland, which is one of the oldest statewide peer-operated behavioral health advocacy and education organizations in the country, which dates back to its inception in 1985. I retired at the end of 2020, but I'm still involved with Honor OWN of Maryland and in the behavioral health advocacy movement here in Maryland. Cynthia has had a long and distinguished career working in the behavioral health system here in Maryland, and I've known Cynthia for close to 30 years. She was the director of vocational services for Prologue Incorporated, a psychiatric rehab program from June 1990 to September 1994. And she was also worked for People Encouraging People, or PEP, from June 1984 to June 1990 as director of their retail employment program before coming to work for the Mental Hygiene Administration, which is today called the Behavioral Health Administration. Prior to recent retirement, Cynthia was the director of systems management for the Behavioral Health Administration and a former director of their Office of Planning. Cynthia has been a member of the Honor OWN of Maryland Anti-Stigma Project since 1994 and a valued member of the Anti-Stigma Project Work Group and one of their active workshop trainers for many years, especially in helping to conduct anti-stigma trainings at Coppin State University. Cynthia has been a pioneer and a change agent and a tireless advocate for creating a more respectful, responsive, and effective behavioral health system here in Maryland. Back in the early 2000s, I had the pleasure of being the vice chair and then the chair of the Maryland Mental Health Advisory Council, which was combined with the Federal State Planning Council and is now known as the Maryland Behavioral Health Advisory Council. Cynthia would attend these meetings and served as an administrative staff advisor to the council. She was extremely knowledgeable, focused, diligent, and very helpful to me during my times as chair and vice chair. During my time as the executive director of Honor OWN of Maryland, Cynthia was always very supportive of our efforts to expand and improve the peer movement here in Maryland. She brought insightful perspectives along with personal experiences and helpful suggestions to whatever we were doing at our organization, including efforts in improving cultural competency, our outreach efforts to the broader community regarding our anti-stigma project endeavors, and support for our subsidiary corporation, Main Street Housing, which provides affordable, independent rental housing to mental health peers throughout many jurisdictions in Maryland. Cynthia was an overall joy to work with and a valued partner in improving and expanding the peer movement here in Maryland. On behalf of myself and Honor Owner Maryland, we wish her a very happy retirement, and we thank her for all her hard work over these past years. Congratulations, Cynthia, on this well-deserved award. I now turn this over to Stacy Rudin for further comments.
Let me first say there is no one more deserving than Cynthia of the Mental Health Association of Maryland's Distinguished Service Award. She has spent her entire career seeking to improve the lives of those with behavioral health needs. Cynthia came to work within the Division of Planning in what was then known as the Mental Hygiene Administration nearly 30 years ago. Her early work included developing, monitoring, and reporting on annual state mental health plans. Through this work, providers, families, advocates, consumers, and MHA staff came together to set priorities for the year and were held accountable for progress towards those goals. Cynthia was an early advocate of consumer involvement and direction in the mental health system. She listened, she heard, she insisted the system reflect their knowledge. The planning function included fulfilling all the programmatic and fiscal requirements under the Federal Mental Health Block Growth Program, which grew tremendously over the years. Her responsibilities later increased to include all items related to the much larger substance abuse block grant program. Cynthia's commitment to inclusiveness included her never tiring work with state advisory group, committees, and the like. Her ability to reach consensus shone through in these venues. Cynthia became the manager of the Community Bond Program. Under her guidance, the program grew in range and scope, yielding millions of dollars for community mental health programs. Cynthia's responsibilities increased over the years, including oversight of cultural competence and diversity, training, implementation of evidence-based practice, and many others. Cynthia grew in the position as Chief of Planning. She approached tasks thoughtfully, she set expectations for others, she addressed issues proactively, she met challenges with energy and perseverance. She listened carefully to others' opinions and thoughts. She had a remarkable ability to handle difficult situations. She could confront when necessary, negotiate solutions, was yet able, though, to stand firm in her decisions. Always respectful, always professional, but firm. As the years passed, Cynthia continued to assume greater responsibilities. She was an integral part of the Behavioral Health Administration's executive team and was well respected within the Department of Health. She played a key role in the successful integration of the Mental Hygiene Administration and the Alcohol and Drug Abuse Administration into the Behavioral Health Administration. Cynthia has been, in many ways, the conscience of the administration. She has been relied on for the history of the organization, while at the same time called upon to spearhead innovation and change. Along with greater responsibilities, Cynthia assumed even greater leadership positions, moving from the Director of Planning to the Deputy Director and then to Acting Director of System Planning and Management. Cynthia has worked countless hours of overtime to passionately focus on the well-being of people served by the Behavioral Health Administration. She has created a legacy for Maryland's behavioral health system. What I've shared thus far gives you some idea of the breadth and scope of Cynthia's work. But more importantly, I want to say a few words about Cynthia herself, an advocate, a negotiator, a peacemaker, a manager, a believer in the right of all individuals to be treated with respect and dignity. She openly She openly acknowledged the value of the mentorship she received in her career, and she paid it forward. Many in our system have benefited from her knowledge and her grace. But most of all for me, Cynthia has been and continues to be a true friend. Congratulations, Cynthia. I am so proud of you and so grateful for our many years as working colleagues and for our ongoing friendship. Now, please join me in celebrating Cynthia Petty as the awardee of the 2022 Distinguished Service Award from the Mental Health Association of Maryland.
Thanks, Stacy and Mike, for being part of today's celebration of Cynthia. Unfortunately, Cynthia is not able to join us today, but she prepared remarks and asked me to share them with you. In her own words, good afternoon, everyone. My apologies for not being present. I'm unable to participate due to my current health challenges. First, I wish to thank the MHAMD for this wonderful award. It is an honor and a privilege to be selected to receive this award. I am truly humbled and grateful. Thank you, Mike and Stacy, for your incredibly kind words. As you stated, I do have over 30 years in the mental health field, beginning by working with the Maryland Psychiatric Rehabilitation Programs. That work then led to my career with the state of Maryland Mental Hygiene / Behavioral Health Administrations. I thank you both for amazing support over the years. This recognition is a breathtaking tribute for me, but I did not get here alone. There are so many others who are also deserving of this recognition. My journey included learning from wonderful mentors and leaders. I cannot name them all here, but they include Steve Barron, Cindy Rommel, Brian Hepburn, Stacy Rudin, Lissa Abrams, Tim Santoni, Oscar Morgan, Darrell Plevy, and many other smart, wonderful colleagues. Our collaborations, partnerships, and relationships flourished over the years at the state, local, and federal levels, as well as in the private sector and among the advocacy community. They have been remarkable. Working alongside the stakeholders and consumers in the community who are the eyes and ears of the public behavioral health system fueled my passion and advocacy. My leadership role at BHA afforded me the opportunity to work with our state legislators on efforts to improve access to behavioral health care, develop guidelines for a culturally competent workforce, increase and enhance crisis services, support consumer involvement at all levels, and address affordable housing needs. You listened, and it was wonderful to witness strong legislation that passed and great legislative initiatives come to fruition. The advocacy work continues, especially through MHAMD, the Behavioral Health Coalition, On Our Own, our provider organizations, and many other key organizations that demonstrate a remarkable fighting spirit. I've learned that the champions in this arena come from different backgrounds and experiences, but they work together, they care about one another, and they are mission-driven in all that they do. Most important, they put the individuals served by the public behavioral health system front and center. One almost final thought as I move on into retirement. The Maryland Behavioral Health Coalition, under the leadership of the Mental Health Association and other key advocates and stakeholders, is supporting next generation changes to the Maryland behavioral health system under the Behavioral Health System Modernization Act and several other related bills, including adding state-of-the-art crisis services under the Crisis Now model, providing funding for the new national 988 system, increasing comprehensive community-based treatment through expansion of certified community behavioral health clinics, expanding the collaborative care model in Maryland MCOs to provide measurement-based care for people seeking behavioral health treatment from primary care physicians, strengthening the behavioral health workforce, and improving care for children and youth. If you can do one thing during the coming session and beyond, I would recommend that you use your voice to bring these needed changes to our system, thereby further improving the lives of the people we serve and making an even greater difference than we already have. These are next generation changes, and they matter. Again, thank you so much for this wonderful honor. And thank you for those heartfelt words. We are truly grateful to have had the opportunity to be a partner with you in this work. Before I hand things back to Dan, I want to remind everyone, it's not too late to send a message of appreciation to our award recipients. You can do this right from the event homepage. And with that, I will hand things back to Dan.
Hi again, everybody. Dan Martin again, happy to be back here with you to present our final award of the day, the Legislator of the Year Award. And today I have the distinct pleasure of presenting this award to the honorable delegate from District 21, representing parts of both Prince George's County and Anne Arundel County, the Vice Chair of the House Health and Government Operations Committee, Delegate Jocelyn Pena-Melnick. Delegate Pena-Melnick is being recognized for her leadership in the passage of a wide array of critical bills in 2021, bills that were priorities for the Mental Health Association of Maryland and the Maryland Behavioral Health Coalition, and which will not only help to increase access to mental health and substance use disorder services across the state, but will also ensure that those services are appropriately meeting the diverse needs of all Marylanders. As the lead sponsor of the Preserve Telehealth Access Act of 2021, Delegate Pena-Melnick facilitated a lengthy, sometimes contentious, multi-stakeholder effort to preserve an expansion in the delivery of telehealth services that was implemented early on in the pandemic. That service expansion quickly became a vital part of Maryland's continuum of care, especially the behavioral health continuum of care, ensuring continuity of care and expanding overall access to treatment for Marylanders unable to access treatment in person. And because of her efforts, much of that increased telehealth flexibility is now permanent in our state. Delegate Pena-Melnick was also the lead sponsor on a number of bills last year that will improve health equity and reduce health disparities, both directly and indirectly. One of her bills established a Commission on Health Equity, which will examine the impact of various social determinants on the health of Maryland residents and make recommendations to reduce health disparities. She also championed successful legislation, expanding the collection of public health, race, and ethnicity data, and requiring implicit bias training for the renewal of health licensure. These bills will ensure the availability of widespread, reliable, consistent data, and an appropriately trained workforce, both of which are key to eliminating health disparities in our state. Finally, Delegate Pena-Melnick passed a bill creating the Maryland Behavioral Health and Public Safety Center of Excellence, which will work to divert individuals with serious mental health and substance use disorders away from the criminal justice system. And this too is an equity issue. Black and brown individuals have less access to behavioral health services than white people. They are less likely to receive needed care, and they are more likely to receive poor quality care when they are treated. This results in a disparate criminalization of Black and brown people with behavioral health disorders, and it's something that this Center of Excellence will be working to address. And so you can see really a remarkable year of progress and success. And without further ado, please join me in welcoming and congratulating a fierce advocate and an incredibly effective legislator, the Mental Health Association of Maryland's Legislator of the Year, Delegate Jocelyn Pena-Melnick.
Thank you, Dan. I'm humble and eternally grateful to be recognized as Mental Health Association of Maryland Legislator of the Year. I'm so excited and moved. While I am honored in name, this award really represents the work that we, all of us, do together. I could not do this work without the advocates, without your time, your commitment, all the hours that you spend in Annapolis and organizing the community. So I dedicate this award to you. We were able to advance, as you said in your speech, a lot of great legislation. And again, I could not have done it without you. Legislation to reduce health disparities and to address social determinants of health that affect access to care. I'm proud of our work regarding behavioral health disorders. I couldn't do this work, as I said, without your support, your advocacy, and your leadership. I know that this work must continue. Together, we can continue to transform the behavioral health care landscape in Maryland. I am ready to work. I am committed unconditionally, and I'm honored. Thank you so much.
So congratulations again, and a sincere thank you to all three of our 2022 awardees. Your efforts and accomplishments are incredibly admirable and inspiring to all of us. And again, to all of you watching, please help us congratulate these champions using the kudos board on the legislative briefing homepage. And now let's turn our attention to the legislative and policy portion of today's event. As you've been hearing, MHAMD and our coalition partners have aligned this session around several robust policy agendas to improve access to services across our state. You'll hear today about all of those. You'll hear about the Behavioral Health Coalition's efforts to modernize Maryland's behavioral health system, efforts to ensure the successful implementation of the forthcoming 988 National Crisis Line, efforts to address the unique needs of children and youth and those of older adults. You'll hear about harm reduction efforts, suicide prevention efforts, parity enforcement, and more. But first, as I said earlier, 2022 is an election year. As such, the Mental Health Association of Maryland invited every declared candidate for governor from every party to say a few words during today's briefing about their mental health and substance use platforms and the issues that matter most to them. And we are very grateful to the candidates who took us up on our offer, and we're excited to hear from them throughout the remainder of today's event. And so let's hear from a couple of them right now.
Hi, everybody. Our state is suffering from a mental health care crisis, and people's lives are at serious risk. It affects everybody all the time, and particularly now in the light of COVID. Rates of suicide and attempted suicide have increased within every segment of our society, and they continue to rise every year. The state of Maryland has consistently failed to deliver the accessible, quality mental health care services that will save lives. We have to do better, and we don't have a moment to waste. I've introduced a thorough plan to address Maryland's mental health crisis. It's called Mental Health Matters, and it's on our website, and I really hope you all will go check it out at www.douggansler.com. We can and we will build new behavioral health centers in every region of our state, each with full-time psychiatrists, social workers, and therapists. We can and we will place certified licensed mental health professionals in every public school in Maryland. We can and we will provide our law enforcement officers and all first responders with immediate access to mental health care professionals with specific expertise in conflict resolution, substance addiction, and PTSD. We can and we will provide free college tuition or forgive the student loan debt of any psychiatrist, therapist, or social worker who practices in the state of Maryland for at least 10 years. We can and we will make a generational investment in the treatment and care of children diagnosed with autism, like my nephew Vance. And yes, we will establish a high-level suicide prevention person that will provide focus and resources to this problem like never before. These are just some of the parts of my comprehensive plan. I want to hear more and more from you in the community, but to learn more about what we're thinking and to share your thoughts and advice to us, please visit douggansler.com and go to the Mental Health Matters portion of the website. And thank you again for all you do to address this serious and growing issue.
Hi, I'm Peter Franchot, the Comptroller of the great state of Maryland. I'm running for governor. I consider mental health to be one of the most important priorities of my new administration. Let's face it, the pandemic for 2 years has put us in a very difficult position. There are entire sectors of our workforce, our teachers, our healthcare workers, our first responders, our support staff, all over the state of Maryland. They're exhausted. They are burnt out. They are in need of easy, affordable, accessible mental health counseling should they decide they want that, so that we don't have a lot of their problems becoming crisis problems. We, in addition to that, need to address the mental health of our population even without the pandemic. It's critically important. So I'm looking forward to being your next governor, being able to work with the Mental Health Association in Maryland to make all of our citizens mentally healthy, independent, optimistic about the future, and capable of expressing everything they need to without stigmatizing or making them feel bad. So yes, mental health is a #1 priority for me.
Thank you, Comptroller Franchot, former Attorney General Gansler. The Mental Health Association of Maryland looks forward to working with either of your administrations should you become Maryland's next governor. And now, this is the MHAMD legislative briefing, and we're going to hear from a bunch of legislators in just a few minutes, but good policy doesn't just happen legislatively during the 90-day General Assembly session. Folks are working in the state year-round to improve our system of care for Marylanders with mental health and substance use disorders, and none harder than Maryland's Deputy Secretary for Behavioral Health, Dr. Aaliyah Jones. Dr. Jones and the Behavioral Health Administration have been doing some great work to increase access to services across the state, and there are many exciting initiatives underway, and we are going to learn about a few of them right now.
My name is Dr. Aaliyah Jones, and I am the Deputy Secretary for Maryland's Behavioral Health Administration. Thank you so much for this opportunity to come and share with you some of the highlights and interest in foci of Maryland's Behavioral Health Administration for the next, for the immediate foreseeable future. Thank you for all the work that you all do in helping to ensure that the behavioral health community has access to the care, treatment, and supports that they need. And thank you for all the advocacy work that you do. It is critical that we continue to look at our system and to push it to ensure that we are meeting the needs of those who most need behavioral health services and resources. So with that, again, I say thank you to all of our partners in this fight and in this work. Thanks for all that you do. I'm going to be sharing with you today some information about some of the priorities that we have for the foreseeable future, including our work in health equity, where we are with telehealth utilization, our crisis system work, bed registry and referral system efforts, as well as our public awareness campaigns, which I'm really very excited about. Lots of strong work happening there. As you all know, the Behavioral Health Administration has been focused on behavioral health equity for years. However, with much greater focus over the past couple of years in light of all that's happening in our world today. One of the areas where this work is having its greatest impact is in looking at the opioid-related death disparities within the Black community. You all have seen this slide plenty of times before. We remain laser focused on identifying ways to stop this trend and the increases in opioid overdoses within the Black community that is seen not only in the state of Maryland, but also across the nation. One of the ways that we're doing that is through the Opioid Death Disparities Task Force, which I chair with Dr. Noel Brathwaite of Minority Health and Health Disparities from the Maryland Department of Health. We have a wonderful group of task force members and work group members who are focused on identifying projects and policies, programs that can be used to address this gap within our community. And hopefully we will be a leader in this space in the nation. With regards to telehealth, I'm very excited to see that we continue to see strong growth and utilization of telehealth services within the state of Maryland, not only in our mental health populations, but also seeing strong continued growth of this as a service modality in our substance use disorder population as well. All of the information that we have collected from our provider community has shown that telehealth has been very helpful in reducing the barriers to access to care and also has just made it easier and made people feel more comfortable in seeking behavioral health services, which is critically important during this time of the COVID pandemic and all of the stress that all of us are under, particularly those who had behavioral health conditions prior to the COVID pandemic, and the many millions of people who have developed behavioral health conditions as an outgrowth or aftermath of the pandemic. And we expect that that will continue for the immediate foreseeable future. We are doing lots of work in our crisis response system, or for our crisis response system. Very proud of the work that we're doing here and trying to help ensure that no matter where a Marylander is, that there is an effective response to their behavioral health crisis, and that regardless of where you are geographically speaking, you have a basic minimum standard that we think is an effective and healthy and useful standard of care to be received no matter where you are. So lots of coordination with lots of partners, not only within the Maryland Department and other state agencies, but also with all of our community stakeholders from various geographies, but also from various disciplines as well. So very excited about this work and working to ensure that there is alignment in what is happening in the crisis response and the crisis and the development of crisis services across the state of Maryland. We have 5 overarching goals of our crisis system work group, which are placed before you, including creating standards and best practices for crisis services. Again, ensuring that people have access to a basic and standardized response to a crisis, no matter where someone may be experiencing crisis. Monitoring how it is that our crisis system is performing through the development of dashboards and implementing standardized assessments, ensuring financial stability and sustainability, trying to move from a grant-funded system to a fee-for-service and other supported system, expanding universal screening and appropriate intervention in child, adolescent, and young adults in crisis, moving from the model being people going to a location for crisis services to a model where the services are coming to you, which is more effective in our younger populations, certainly. And then also ensuring that we have great integration of the 988-211 systems within our crisis services as well. We have in those 5 work groups, each work group has several goals that they'll be working towards advancing over the next year, which include developing uniform crisis definitions for our crisis services, creating regulations and implementing HB 332, which is our alternative destinations for emergency petitions, expanding the peer workforce in our urgent care centers with regards to our data dashboard and system mapping, focusing on creating a uniform data system for assessments and tracking this data, for our financial stability and sustainability efforts, including the implementation of our CMS grant and moving our crisis services forward into the fee-for-service world. We're specifically working with Medicaid to identify elements for mobile response crisis teams to make them payable through Maryland Medicaid. And there's an 85% match that's going to be available starting in April of this year. So we're really excited about that movement. And our child and adolescent young adult space, developing the mobile crisis services across the state to service our children, our youth, and our families, which will include this universal screening tool and ongoing follow-up through mobile response and stabilization. And lastly, for our 988 integration, as you all well know, 988 is going to become operational in the country in July of 2022, and we're working with call centers around the state to ensure a seamless transition between 211, Press 1, and 988. And I have to say that, and I would like to acknowledge all of the work that's being done by all the various chairs within the Behavioral Health Administration. They have been doing phenomenal work over many years, but certainly most focused over the past year, and really pulling together what's happening in the crisis services space and really creating a Maryland model for crisis response. With regards to our bed registry efforts, we have a lot of work going on there with HB 1121. You all know the challenges with coordinating care and getting into care, moving through systems of care throughout our behavioral healthcare system. So we are excited about this legislation. It's a huge challenge. However, we are working hard to ensure that we meet the expectations of this legislation. We have hired a project manager who was onboarded just in January. We have a full project management plan that's under development that's going to tie in the operational aspects of this project with a longer term IT build. We have a pilot project concept that is currently being designed where we're looking at placing behavioral health hospital liaisons at the local level, and also creating such a position within the Behavioral Health Administration to help with coordination for the more difficult to place individuals who find themselves in a hospital system. And we have a lot of work going on with trying to create or really to make available a provider directory that can be useful to the general public. So we're looking into that. And we are hoping to be able to launch a pilot targeting March 22 with regards to the liaisons. And some of you may be aware that we did just roll out a bed registry in response to the COVID pandemic, but it's also in line with this work here, where we now have visibility to available beds in all, or at least the majority of acute care units across the state, to help make it easier and faster for people to move from an emergency department to an inpatient unit. That just went online as of yesterday. So really excited about that. And our public awareness campaigns, we have a wonderful team that develops public awareness campaigns that you all likely, hopefully have seen in print and media and in print and in media. One of the things, projects that was developed this past year was the Naloxone electronic toolkit, which was designed in response to the business community, or developed for the business community, to help them know how it is that they can become healthcare heroes, and really embedding, making Naloxone available in case there are crises on various work sites. And this is an award-winning campaign. Really excited about the work that's been done there. We've also been very vocal in trying to ensure that our primary care partners are aware about their increased ability to prescribe buprenorphine due to the changes and regulations at HHS. So pushing out a print campaign to that end, which some of you may have seen. And then lastly, our fentanyl campaign, our fentanyl awareness campaign, which I hope that you have seen the commercials for this as well. It's a wonderful campaign that is in English and in Spanish, that has digital and audio ads that target casual substance users to let them know that lots of substances have been laced with fentanyl, and a casual use of anything at this point in time could potentially lead to an opioid overdose. And so we just want people to be aware of the risks. And so I'm excited about that project and I have seen that, and hope that you all have seen that as well. And so with that, I'd just like to say thank you for your time and for your attention. Thank you for your partnership with the Behavioral Health Administration, and your partnership and support of me personally over my past 2 years as Deputy Secretary for the Behavioral Health Administration. I look forward to continuing to work with each of you in a different capacity in the coming months. And I just hope that you all have a wonderful, wonderful day. Thank you.
Hi, my name is Laura Newman, lifelong Maryland resident and candidate for governor of Maryland. I'm so happy to be here today to talk about one of the most important issues of our time. We are making progress in addressing mental health issues, but we have a long way to go. I'm going to talk about it from a personal perspective. My father dealt with mental health issues when I was just a toddler. He was admitted to a mental health institution because he threatened to kill his family and himself. I understand this from a personal perspective, and this is what I know. When we don't address mental health issues, they go from generation to generation to generation. In my family alone, I have a sister who is schizophrenic. Both of my parents have dealt with mental health issues, and I personally have had to deal with it myself as a victim of rape. There weren't any services available to me when I needed help, but I can tell you later on, I went and sought help when I needed it, and it helped me have the incredible life that I experience today. That would not be possible. What I've been able to do in my life, in my career, and in my family would not have been possible without mental health support. I ask all of you to consider the importance of being partners in this. Thank you for talking about it. Thank you for bringing it to the forefront and making it a public discussion. It's not easy to talk about, but if we're partners in this, we can make great progress. Thank you for having me today.
This is Rashard Baker. In addition to being a candidate for governor of the state of Maryland, I served in the legislature. So I want to thank the Maryland Mental Health Association for the fine work that you have done in the past and that you're doing now. As someone who was a caregiver for my wife for over 10 years, I know how important it is for behavioral and mental health as part of, our advocacy work. And I want to thank you for doing that. As a former county executive in Prince George's County, we made behavioral and mental health a key component of making our county better in Prince George's County. So thank you and good luck in this session and moving things forward.
Righty. Well, thank you, former County Executive Newman, former County Executive Baker, and thanks so much to Dr. Jones and everyone at the Behavioral Health Administration for all you're doing. Really a lot of great work happening. And now let's turn in earnest to the legislative briefing portion of the event. As I said earlier, Mental Health Association of Maryland and our coalition partners are working to advance several robust agendas this year to increase access to care for all Marylanders when and where needed. And it is, as you've been hearing, it's critical right now. The COVID pandemic has really exacerbated an already rising demand for behavioral health services. And we are seeing a need for quality mental health and substance use care like never before. This time last year, nearly 40% of Marylanders reported symptoms of anxiety or depression, yet nearly a third of those individuals were unable to get counseling or therapy. Over 45% of Maryland youth aged 12 to 17 who have experienced symptoms of depression did not receive any mental health care last year. 650 Marylanders lost their lives to suicide last year, and nearly 2,900 lost their lives to overdose. 16 entire counties out of 24 in Maryland have been federally designated as mental health professional shortage areas, and hospitals across the state continue to see huge numbers of people accessing their emergency departments for help with behavioral health crisis needs. And so meeting this challenge is going to require an all hands on deck, comprehensive strategy, smart investments, efficient use of resources, but most of all, it's going to require unity and commitment from Maryland's behavioral health community. And we are so happy to have the support of many legislative champions in this fight. You're going to hear in just a minute from Delegate Heather Bagnall, who is sponsoring the Behavioral Health Coalition's premier piece of legislation this year, the Behavioral Health System Modernization Act, which will enact a series of reforms and enhancements designed to meet the increasing demand. You'll also hear from Senator Malcolm Augustine, who is spearheading efforts in the legislature to support the new 988 crisis call line that Dr. Jones and others have been talking about throughout this event today. But first, it will be critical to ensure that our public behavioral health system is fully resourced and fully funded, and that's why we are so happy to have this next speaker fighting for us in Annapolis. The chair of the Senate Budget and Taxation Committee and the lead sponsor of a few years ago of the Behavioral Health Coalition's Keep the Door Open Act. Please join me in welcoming Senator Guy Gazzone.
Hi, everyone. This is Senator Guy Gazzone. I am always glad to be with you, even if it's only virtually this time. It seems like eons ago when we worked together on Keep the Door Open back in 2017. And yet there's so much more to be done. As you know, I'm a budget guy. I chair the Senate Budget and Tax Committee. And everyone right now is hearing that the state is flush with cash, which is a good thing. But I need to be clear about what is really going on, especially as it relates to mental health, because it's important to understand that there are different components to a budget. And what we have seen over the last couple of years is an increase that created a surplus, but is only good for one-time expenditures. I think, unfortunately, for the things that we work on the most in mental health, the expenditures go on for long periods of time. They're part of the operating budget, not the capital budget, although we do some capital work too, and we're gonna absolutely help with some facilities, I'm sure, across the state with some funding. But at the end of the day, as you all know, particularly given this last couple of years with COVID and the effects that COVID has had on the mental health of our society, we've got so much more to do. You know, I was very proud back to those Keep the Door Open days, and that was all about improving the rates for providers so that they could provide better and more services. Well, we're, I think, in many ways, much worse off in terms of ensuring that that everyone who needs access has access. It's just an ongoing problem, and figuring out a way to improve the rates again is going to be a big deal. That's something that has to go into the budget year after year after year. We have a couple places where we think some good things are happening. In the blueprint, the Kerwin Bill, now with a lot of focus on our children and our children's mental health. There's a big piece of mental health access that we're working on, referred to as a consortium. And I'm really hopeful. It's not funded at a level that I think is necessary at this point. We're going to need to do a lot more. And I'm hopeful that we should be getting more access through our schools, particularly given all that's happening with our children, suicide rates going up, addiction rates going up. It's a scary time for that, and we need to really redouble our efforts. I know another major component of what's going on right now is initiating the 988 service, which of course will give people the ability to call in when they need mental health services. And it'll be a simple number that everyone can use. It'll be nationwide. But and that's really important. But more critically is that we have the services on the other end, that when folks call in, they have somewhere to go, whether it's urgent care or beds or whatever it is that's needed. We need to really, again, redouble our efforts. I believe, and I'm encouraged, because folks now seem the stigma issues, the willingness to talk more about these issues is the stigmas are going. The willingness to talk has become more open, and that's a great thing. It's helping us do the job in the legislature in terms of looking for more resources, and I'm going to be doing that every single day. This is a huge and top priority, I think, for our state, for our society as a whole. I'm grateful to the association for all that you have done and all that you will do, as we do hopefully together. So I look forward to this year seeing some successes, and as we move forward over the years. It is a multi-year issue, and it will be going on for many, many years to get up to a state where we feel like we're really doing the very best for our citizens. But I'm committed to that. I know you are. I look forward to ongoing working together. Thank you.
Thank you for that kind introduction. I know we would all prefer to be in person, but I greatly appreciate the Mental Health Association of Maryland's continued commitment to the health of our community. And I'm therefore so truly honored to speak with you this afternoon virtually and to champion with my Senate partner, Malcolm Augustine, the Behavioral Health System Modernization Act. In 2020, when the pandemic first hit Maryland, I started raising alarm bells about a potential second behavioral health crisis. The pandemic has caused a huge increase in the demand and the need for mental health and substance use services. Maryland has a really good behavioral health system, one of the best in the country. It's part of how we were able to continue providing services throughout the pandemic, why we worked so hard to expand access and equitable reimbursement for telehealth. But as we begin to see a reduction in COVID, We need to use this opportunity to turn our full attention to making our good system a great system. And we can do that with just a few enhancements. That's why this session we are going to pass the Behavioral Health System Modernization Act, because that is what it does. It will implement a series of reforms that will bring Maryland's behavioral health system into the 21st century, so we can meet the increasing demand for high quality mental health and substance use services by focusing on equitable community-based services, individualized integrated care, and workforce development. Specifically, the bill will expand comprehensive community-based treatment with certified community behavioral health clinics by requiring the establishment of certified community behavioral health clinics across Maryland. These federally designated, proven models deliver a comprehensive range of outpatient mental health and substance use treatment, care coordination with other providers and services, and connection to other systems and supports. We'll improve health outcomes and treatment quality by expanding the delivery of individualized, data-driven, measurement-based care in behavioral health settings, and by enhancing care coordination in primary care settings. We'll strengthen the behavioral health workforce with peer support networks and certified peer recovery specialists. Specifically, the bill will expand resources and professional opportunities for individuals with lived behavioral health experience, so they may better assist others in navigating treatment systems and recovery support services. We'll improve care for children and youth with behavioral health needs by increasing the availability of comprehensive home and community-based wraparound services and supports for children, youth, and families. And we'll reduce reliance on law enforcement and emergency departments by enhancing Maryland's network of crisis call centers, mobile crisis teams, and crisis stabilization facilities. Now, I won't pretend this is going to be easy, but it is absolutely necessary, and it will be life-changing. Maryland has already been moving in the direction of an integrated system of care, and the Behavioral Health System Modernization Act will bring all of that work together. We can't wait while our Maryland citizens suffer. We have the opportunity to be a leader in the nation on behavioral health care, and I am so humbled for the opportunity to be that leader. Thank you.
I'm Senator Malcolm Augustine from Prince George's County, and I'm so grateful for the work the Mental Health Association of Maryland does working for better behavioral health outcomes for all Marylanders. The COVID pandemic has made mental health and substance use worse for Marylanders, greatly increasing the number of people who are seeking help for mental health and substance use services. Congress authorized the states to designate 988 as the new phone number for mental health and substance use crises, which will greatly increase the number of calls for help. Marylanders deserve a well-operated and fully funded mental health and substance use crisis response system that they can depend on to deliver equitable, timely, and effective care in times of emergency. That's why I'm so committed to passing Senate Bill 241, the Maryland Behavioral Health Crisis Response Services 988 Trust Fund. This legislation will establish 988 as Maryland's behavioral health crisis hotline for mental health and substance use crises. It will establish a state fund to invest in 24/7 call centers, mobile crisis teams, crisis stabilization centers, and related crisis response services, and allocate an initial $10 million in 2022 to the fund to ensure that call centers are adequately staffed and available 24/7. I'm grateful for the strong support of Mental Health Association of Maryland. With your help, we will pass this critical public-facing behavioral health legislation that will bring better behavioral health outcomes for Marylanders. Thank you very much.
Hi, my name is Tom Perez, and I am running for governor because I want to bring jobs, justice, and opportunity to everyone in every zip code across the wonderful state of Maryland. I want to thank the Mental Health Association for your leadership and advocacy for so many years on these critical issues of mental health and behavioral health across our state. I remember when I was on the Montgomery County Council years ago, working with the Mental Health Association, because you were always in the forefront of what we should be doing. You know, we don't have simply one crisis in the healthcare setting right now. We have two. We have the global COVID-19 pandemic, but we also have a mental health crisis. These last 2 years have been so challenging. And if governor, one of the things I would want to do, first of all, is spend some of our surplus funds to invest in building out that mental health and behavioral health infrastructure. We need to work with our educators, teachers, and other professionals in the ecosystem of our education system are struggling day in and day out because of the challenges that have been brought about by this pandemic. And we need to make sure we invest to help our educators and others and our students so that they can address the mental health needs that are a product of this pandemic. We need to make sure we're building out a community-based mental health and behavioral health infrastructure. I used to work with police departments that were encountering a lot of challenges when I was working at the Civil Rights Division of the Department of Justice. And one of the things we did across the country was work with police departments to build a community mental health infrastructure. So when law enforcement is encountering someone who's in mental health crisis, they have the tools and are equipped with those tools to help diffuse a situation. Tools such as assertive community treatment teams, things of that nature. So we need to build out those infrastructures with our law enforcement communities. We need to make sure that there is enough treatment programs available. We have another record year of opioid-related deaths. That's preventable, and we must all come together. We will have a settlement in the coming years in the lawsuit against the Sacklers. I'm confident of that. We need to make sure that we are ready to take those dollars and put them to use in communities to build out the mental and behavioral health infrastructure that we need. For me, this issue is not simply something that I've studied. It's something that I've experienced personally. My mother struggled with depression throughout much of her adult life. I know what it does to families. I know the struggles that exist here. And I know that the Mental Health Association has been such a leader in this. And I am going to work together, if I have the privilege of being your governor, to make sure we address these issues, because it is long overdue that we make mental health awareness, behavioral health awareness, a central part of what we do as a state. We can address these issues. We can improve the situation. And I look forward to being your partner in that effort.
Hello, I'm Wes Moore, Democratic candidate for Maryland's governor. And thank you for the opportunity to address the Mental Health Association of Maryland's annual legislative briefing. It's an honor for me to be here because the issue of healthcare is a deeply personal one for me. When I was just 3 years old, I watched my father die in front of me from a virus that was completely treatable if he had just received the basic care that he deserved. And that experience shaped my life, it shaped the life of my sisters, and it specifically shaped the life of my mom, because now she was going to be a widow who would raise 3 children on her own. And that was not the life that she prepared for or expected or prayed for. And specifically, that experience shaped the way I look at healthcare. And in my view, that affordable quality healthcare is a basic right that every Marylander deserves, period. And despite Maryland's strong access to health coverage, there's still so much more work to do. In 2020 alone, we lost 2,773 Marylanders to drugs and alcohol, and another 650 to suicide. Now, the growing acceptance of mental health and substance abuse in the American lexicon is a giant stride and leap forward in the right direction. But we need to add some support to the saying, it's okay not to be okay, by adding on, and there are places that can help. We must never rest in our push to make mental health and substance abuse awareness as treatable and accessible as care and coverage for physical ailments of all of its patients. We need to work to increase access to mental health professionals and addiction recovery centers, full stop. This is personal for so many Marylanders, and we must move accordingly. And in my administration, we will not rest until we secure the funding and the resources that we need to ensure that every Marylander has access to the treatment that they need and will not leave any options off the table in order to get this done. Thank you for your leadership. Thank you for your fight on this crucial issue. And in partnership, I know that we can get the work done. Thank you.
Right. Thank you so much, Wes Moore, to Tom Perez, and thanks to Senators Gazzoni and Augustine and to Delegate Bagnall. It's really wonderful to have such strong champions. And so moving on, children and young people have been especially hard hit by this pandemic, and they are facing a variety of unique challenges, unique behavioral health challenges. And that's why Mental Health Association of Maryland and our Children's Behavioral Health Coalition have prioritized a series of legislative efforts to improve services and supports for this population. You'll hear in this next section from Delegate Ann Kaiser about her efforts to improve the educational funding mechanism for youth in out-of-home placements, from Senator Mary Washington about her bill to reduce discrimination and increase access to care for transgender youth, and from Delegate Tony Bridges on his efforts to expand youth-led and youth-designed community prevention programs. But first, let's hear from Delegate Chris Valderrama about her efforts to ensure that Maryland families are afforded the time they need to care for loved ones in their families.
Hello to all of you. For those who may not know me, my name is Criselda Valderrama, and I represent in Prince George's County in Legislative District 26 in the Maryland General Assembly in the House of Delegates. I am here before you today to speak to you as to why we need to move and the important measure that we are trying to move this legislative session, of which I am the lead primary sponsor on, which is House Bill 8, the Paid Family and Medical Leave Program, also known as the Time to Care Act bill. I would just like to cover some points and hopefully I can get my message across to all of you that for those who are familiar, basically in essence, this bill is a family medical paid insurance plan similar to our insurance plan that we run here in the state. It will provide up to 12 weeks of partial wage replacement. And I emphasize partial wage replacement because some folks, they may or may not use it because they're not able to sustain on a partial wage replacement, but by no means do we have the conception that one could live off of just a partial wage replacement. However, so the bill, it establishes a family medical insurance plan. It's not the same as paid sick leave because it's not a benefit solely provided by an employer. It is an insurance plan that, as I said, partial wage replacement for up to 12 weeks. It's a self-funded plan, no state fund are involved. Our legislation seeks to get a 50-50 contribution from both the employer and the employee. Why is this measure necessary? I know some arguments have been family medical leave exists, but let us not be mistaken. While that is a groundbreaking piece of legislation, it is not paid. And for many of us Marylanders who are suffering and who have suffered and are still suffering, not just from the pandemic, that is a big reason as to why we need this measure, this insurance plan. And I'm hoping that with myself and my cross-file across in the Senate, Senator Antonio Hayes, that we are able to get our message across to all of you that you may spread the word that this year, the time is now to move the Time to Care Act bill. Thank you.
I'm Delegate Tony Bridges of the 41st District in Baltimore City. Maryland must recognize the role of youth preventive programs as evidence-informed model to reduce and prevent incarceration. Our state should invest in innovative preventive programming for youth that is focused on providing easily accessible, strength-based interventions at the earliest opportunity possible. Youth preventive programs are evidence-informed and are co-designed with youth to consider their unique needs. We're working to secure some reporting on current practices and youth preventive programs supporting the behavioral health needs of youth at risk of incarceration or recidivism, a review of youth-centered, youth-designed prevention models being implemented nationally and with evidence-based outcomes and recommendations for statutory, regulatory, or other changes that could allow for expansion of programs in Maryland to best serve youth and families as an intervention to incarceration and with a goal of reducing youth detention.
I am honored today to speak with you and also the Mental Health Association of Maryland. Many of the people in this meeting have done so much hard work, providing important work to tear down barriers and to fight against discrimination around issues of mental health. In my career in Annapolis, first as a delegate sitting on the Joint Committee on Ending Homelessness and having the honor to chair that committee, and then continuing that work as a senator to chair the Joint Committee on Children, Youth, and Families, I've fought for the prevention of youth homelessness, particularly among our young and marginalized communities, many of whom are survivors or suffering from mental health and behavioral health ailments that prevent them from finding affordable and effective care and housing. The reality is that discrimination, lack of options, and an unaffordable health system creates more than just anxiety. It can lead to a number of serious mental health issues that are harmful to individuals and to the people around them. It also hurts our society. If we're not here to do the very hard work of providing help to our young people, it hurts our society because far too many people are marginalized from being who they are and who they know they are. And in the case of youth and homelessness, there aren't enough allies to make their voices heard. So I'm honored to count myself among one of the allies that stands behind every young person who is going through a transition of trying to find themselves and their identity of who they are and what the future holds for them. Everyone wants to feel accepted and respected. This is particularly true and difficult in our LGBTQ community. Mental health is paramount to the healthy development of all people. And this is one of the reasons why I've introduced Senate Bill 682, Maryland Medical Assistance Program, Gender Affirming Treatment. The vast majority of LGBT people and students report experiencing some sort of harassment in schools, and these schools report lower levels of self-esteem and higher levels of depression than their peers. For transgendered and non-binary young people in particular, and their parents, more than half report seriously considering ending their lives. Many of these youth cite the important role of gender affirming support systems, of access to gender affirming care, and linking this directly to improved health outcomes for them. So this bill will increase access to medically necessary and gender affirming life-saving care for transgender people, youth, adolescents, and adults. It will ensure that Medicaid will provide medically necessary care based on our up-to-date standards, and it will reduce sex-based discrimination by providing healthcare based on clinical need. This bill will increase access to critical care for so many transgender youth. So this will lead directly to improved mental health and will save the lives of so many of our people and our young people. So thank you for being in this meeting. Thank you for who have helped raise my awareness and my understanding and my consciousness in this area. Again, I'm honored to be an ally in this fight, and particularly in this time of isolation, know that you're not alone, and that we know that it is the utmost importance that we support each other's mental health and make sure that regardless of race, social, economic status, age, or gender, that everyone gets the health care that they need. Thank you so much.
Hello. I want to thank you all for inviting me to speak, not just to have this opportunity, but really to thank you for all the work you and your organizations do on a daily basis to help individuals across the state of Maryland. I continue to believe that the role of government is to serve the least among us, and any way that the legislature can support your efforts in providing services, we are better as a society. This session, as you may know, I've introduced House Bill 766, Children Residential Treatment Centers Education Funding, a really clunky long name to making sure that students get the services they need. My partner in the Senate is Senator Kathy Klossmeyer, who's introduced identical legislation. Having these bills move simultaneously in both chambers should enhance its success. I do have to apologize if you hear any noise in the background. I have my daughter with me today because we don't have childcare, so she might run into the screen at any point. Every child in Maryland, in the state, deserves an equitable and appropriate education. And of course, students with special needs deserve a free and appropriate education. However, we don't always measure up in this regard, though I am proud of the many small steps we've made in this direction over the years. The legislation that Senator Klossmeyer and I have introduced this session should ensure that students who need a non-public placement in a residential treatment center for either medical or psychiatric purposes will receive their needed health and education services, while at the same time not bankrupting their parents. And that really is a key point. I want to thank Ann Geddes with the Maryland Coalition of Families for bringing this bill to my attention, and also thank the Mental Health Association of Maryland and Catholic Charities of Baltimore for also working with me and working to advocate in favor of this bill. Together, we are certainly stronger. And I think and I can speak for them as well, welcome any other organizations who want to lend their support, particularly with written testimony, and of course, calling any legislator with whom you have a strong relationship. I want to thank you again for inviting me to speak, and I look forward to passing this legislation. Thank you all very much.
My name is Ashwani Jain, and I use he, him pronouns. I'm a 32-year-old cancer survivor who's a son of immigrants, a product of Maryland public schools. I've worked in the public, private, and nonprofit sectors, and served in the Obama White House and 2 federal agencies. I'm running for governor to make our politics more inclusive and accessible. And as a cancer survivor, someone who currently works at a healthcare nonprofit, someone who previously worked as one of the directors of the Affordable Care Act at the U.S. Department of Health and Human Services, and then as Vice President Biden's Director of Outreach for the Cancer Moonshot, healthcare is a personal issue to me. And this obviously includes mental health. Unfortunately, there's a huge stigma in communities of color to address our mental health. And that's why I not only share my own struggles with depression and times when I felt suicidal, but why I believe in investing in more trained mental health professionals in our schools and our criminal justice system. At janeforgovernor.com, you can find my proposals to finally treat opioid and drug abuse as a disease and not as a crime, and to provide dedicated funding for nonprofits that help take care of our neighbors when they are in need. If you are struggling, please know you are not alone. I am with you, and as governor, I will fight to ensure that you have the resources you need. Thank you so much.
Hi, I'm John Barron. I want to thank the Mental Health Association of Maryland for this opportunity. Maryland is in the midst of an unprecedented mental health crisis, one that existed long before this pandemic, and it's gotten worse. Our suicide rate today in Maryland is nearly 25% higher than it was in the mid-2000s. We're facing the worst drug abuse epidemic in Maryland history, with the 7th highest overdose death rate in the country. But even beyond those alarming figures, mental health problems are extremely common. Personally, I dealt with social anxiety as a teenager and a young adult that was a real obstacle in my own life. And if you're watching this, the odds are you or someone you know has suffered from a mental health issue. These problems demand our urgent attention. But to make progress, it is not enough to just roll out new, unproven programs, because many programs, for example, to prevent substance abuse, don't work. We've seen that too often when the results are actually measured. To make progress, we must expand programs that have been tested in the real world and shown to deliver results. As one example, we will expand a life skills training program to middle school students across the state, teaching children critical skills in resisting peer pressure. This program has been shown to reduce long-term rates of substance use by as much as 30%. We will also implement other promising evidence-based programs like youth-nominated support teams to prevent teen suicides, and certain cognitive behavioral therapies to prevent or to treat depression. We'll expand Medicaid to ensure that these types of evidence-based programs are fully covered, because mental health care is health care, and these programs could make an enormous difference in the lives of thousands of Marylanders. This is critical. It is personal to us all. It will be a top priority when I'm governor. Thank you.
Thank you to John Barron and to Ashwani Jain. And thank you to Senator Mary Washington and Delegates Valderrama Bridges, and Kaiser. Really appreciate everything you are all doing for Marylanders. And so moving on, the next section is our final section of the day. We're going to cover a range of very important issues. We'll hear from Delegate Robin Lewis about her bill to ensure proper enforcement of parity laws through the creation of a consumer health access program. Senator Addie Eckert will talk about her bill to create a suicide fatality review committee. Delegate John Carden will talk briefly about his efforts to expand legal protection for people who report an overdose. And Senator Jeff Waldstreicher will talk about his bill to expand supported decision-making as a way of preventing the need for public guardianship. But first, we will hear from Senator Melanie Griffith about the work she is doing as a member of the Senate Budget and Taxation Committee.
Greetings, I'm Melanie Griffith, President Pro Tem of the Maryland State Senate and Senator representing Legislative District 25 in Central and Southern Prince George's County. I want to first thank the Mental Health Association of Maryland for including me in your 2022 legislative briefing event. For those of you who may not know, I served as a clinical social worker for over 10 years, so I know firsthand how important it is to provide access to high-quality health care and behavioral health services for all Marylanders, especially our older adults. In addition, over the years, I've been honored to sponsor and co-sponsor legislation that increases access to behavioral health services, such as the Preserved Telehealth Act of 2021, and this year, Senate Bill 398 I co-sponsored that will help allow out-of-state practitioners to help fill the gap where we are having a healthcare provider shortage. In addition, this year, as a member of the Senate Budget and Tax Committee, I'll work alongside my chair and our colleagues to ensure that we avail ourselves of every opportunity to provide additional funding for behavioral health and mental health services in the state of Maryland. Thank you so much for allowing me to participate in this event, and I wish you all a very safe and successful session.
My name is Jeff Waldstreicher. It's an honor to serve as a state senator representing Lower Montgomery County here in the Maryland State Senate. This year, it's my privilege to introduce legislation related to supported decision-making. Supported decision-making is when people with disabilities, including mental health challenges, have the opportunity to have more of a say in their own care. This issue is deeply personal for me. My sister has an intellectual disability and she's been very kind to let me share her story. She's high functioning and needs help, but she wants more of a say in her own care. She wants to be able to make more decisions for herself. And she's deserving of that choice as a human being, as someone with dignity and agency. And I want to help provide that to her and others who are similarly situated with mental health challenges, with intellectual disabilities, with physical disabilities. I'm so optimistic about our ability to pass this bill this year, but I can't do it without your help. So please, when you have a moment, go to Google, type in Maryland General Assembly. Our website will pop up. You can enter your address and find your own state delegates and state senators. Send them an email, send them a tweet, let them know how you feel about this legislation. Tell them personally about how supported decision-making might make your life a little bit easier, a little bit better. So I'm excited about the opportunity to sponsor this bill. I'm excited about the hearing that we have coming up for this legislation. I think we're going to pass it, but we can't do it without your support. So contact your legislators, let me know how you're feeling about the bill, and hopefully we'll see each other at the signing ceremony with the governor. Thanks again for having me.
This is Delegate John Carden, and I want to say thank you to MHA of Maryland for all you do for people with mental health issues. And thank you for your support for HB 90, which I call the Good Samaritan Bill, which protects people who are trying to help others when there is an overdose or there's some sort of mental or emergency issue, when somebody is using illicit drugs or alcohol. They want to call 911, but they're afraid to because they're afraid that they will get prosecuted or charged with a crime because they're in the wrong place, the wrong time, or they're using drugs or sharing drugs they shouldn't be. This bill will make sure that they are protected, that they will not be charged with a crime if they're calling 911 to help save somebody's life or prevent an overdose. We have an extraordinary increase, an exponential increase in overdoses, and especially given some of the issues with COVID, this has been even worse. And now is the time to make sure that people feel safe, call 911, save people's lives, help people with mental health issues, get over them and get to a safe place. So I'm really happy that MHA is going to support this legislation, HB 190. Right now, what you can do is call your legislators and tell them that you want to see this bill passed. It's about saving lives and keeping people safe.
I'm Senator Addie Eckert, and I'm here today to share a little bit with you all about what I've been working on with regard to severe and persistent mental illness. You know, the state's been developing a wonderful crisis team. And in that crisis team, we've had a couple of issues come up. And that is, once somebody's in a psychiatric emergency or a crisis, how are they transported? Do they go in a police car and the police are called, or do they go in an ambulance, or do they go in an alternate means? So we have been working with the Department of Health and others. They put together a work group, including, I think, some folks from MHAMD, to be able to look at how we untangle this issue and who pays for what. So that's one piece of the puzzle. The other issue I've been concerned about is whether we do some kind of an outpatient commitment. We know when somebody decompensates and has a severe psychiatric emergency, getting access to care in a timely fashion, it's really critical. So I went back and I looked at something we had done before, which was the Mental Health Advance Directive. And my thinking was that if we could activate the Mental Health Advance Directive and get the kind of technology, get it uploaded so that wherever the first line, whether it's an EMT, whether it's a physician, whether it's social worker, crisis team, whoever, if they can access that Mental Health Advance Directive, it might be an efficient way to get care immediately so that folks don't have to wait around in an emergency room or having the big debate about what to do next. So that's one piece. I'm waiting on that bill to come up, and the department has agreed to look at what they need to do to get that technology. I've talked with the 911 or the emergency management people about it as well. And then the other piece of that would be to do a little education and information among the providers to make sure that everybody knows how to access that Mental Health Advance Directive and how to use it to be able to intervene early in our psychiatric emergencies. In addition to that, we've had in the Senate today, Senate Bill 94, which is Public Health Maryland Suicide Fatality Review Committee. We've passed this bill before out of the Senate. We hope we can get it out of the House. And it establishes a statewide team of significant players from the Department of Health and other experts on suicide to be able to do an analysis at that suicide fatality review. Those people would have access to the data that they need so that we can put together a real review and to see what we are missing so that we can then gain information to do the earliest intervention as possible to prevent further suicide. So that's an update with what I'm working on regarding mental health, addiction, and suicide.
I'm Delegate Robin Lewis. I'm here to talk about the importance of expanding access to mental and behavioral health services, and to let you know that I'm doing my part to make sure that happens for the people of Maryland. This session, I'll be introducing a piece of legislation called the Consumer Health Access Program. This is a bill, House Bill number 517, that will create a statewide one-stop shop for Marylanders who are seeking or having trouble with accessing mental and behavioral health services. It shouldn't be that hard to find someone to answer your questions, provide support or treatment services that you need. We need to make it easier, and I hope that my bill will do that. Thank you so much for listening. Stay in touch, and we'll see you on the other side.
Hello, I'm Jerome Siegel, by training a philosopher and policy analyst. This will be terribly brief, and if it interests you, go to the campaign website, siegelforgovernor.org. The campaign is the expression of a new movement called Bread and Roses Socialism. It's about balance between work, time, money, and meaning. Bread and Roses emerged from my book, Graceful Simplicity, The Philosophy and Politics of Simple Living. The book's contribution was taking the pursuit of simple living from self-help to public policy, recognizing that the US is a very inefficient society in that it takes a great deal of money and thus labor time to satisfy the most elementary needs. And thus telling people, as Thoreau and others have, to work less and live more deeply makes little sense for those struggling to make ends meet. Likely you're all familiar with Maslow's hierarchy of needs pyramid. At the base are physical and safety needs, and at its upper reaches, the need for beauty, meaning, and transcendence. Bread and Roses Socialism is about both. Our central focus is opening up a simpler living option for all. For those at the top, this means a time liberty law that allows employees without penalty to opt for a four-day week, or even half time, so they can use the release time to do passion work or just to be with friends and family. But for those at the bottom half, this is in itself empty. We have a comprehensive 12-point agenda to make it real. We call those policies the living wage matrix, and it includes: 1, guaranteed basic employment, a legal right to 4 days of job system work that eliminates the threat of unemployment. 2, zero interest mortgages for tiny and modest homes, doubling home ownership at the bottom and allowing mortgage payoff in 10 to 15 years. 2 and 3, tuition-free 4-year college and reorienting schooling towards education for its own sake with more history, arts, and the humanities. Well, sorry, I'm out of time. If intrigued, go to siegelforgovernor.org. Thank you for your attention.
Hi, I'm David Lasher, your Libertarian candidate for governor in 2022. I live in Annapolis, where I am an IT executive, and I live with my wife and teenage daughter. My wife has spent her own career in environmental protection and natural resources. I decided to stand for office after the 2020 elections because I came to the conclusion that our American experiment in democracy is indeed in jeopardy, but not for the reasons that the two big parties would have us believe, rather for reason of the two big parties themselves. They are too divisive in their politics. They are too intrusive with their policies. They are at holy war with one another. I decided to stand as an alternative, a principled, accomplished, and civil alternative. And I'm also a candidate who brings some special, perhaps unique experience from the world of mental health. As some of you may remember, I served in 2016 through into 2018 as CIO, COO, and Chief of Staff at our own Department of Health. Through that experience and opportunity, I gained a special appreciation or passion for behavioral health. I did so through my work on JRA, the Justice Reinvestment Act, of course. I orchestrated the team or led the team that brought down the time for placement from court order to placement within either state facilities for mental health services or community settings for SUD services. Placement times had been taking 40 to 100 days on average. We got those averages for placements down to 15 and 20 days within 3 months. I also bring a life experience of my aunt having been in the first generation of Americans that moved from institutional settings for the developmentally disabled into community settings. So I do have a special passion for mental health, behavioral health, and mental well-being, and it will be a priority of mine if if elected as Maryland governor. Meantime, let's get back to the briefing. I'm glad to be here. I thank you for your time. Goodbye.
Okay, well, thank you, David Lasher. Thank you, Jerome Siegel, Senators Griffith, Waldstreicher and Eckhart, and delegates Lewis and Cardin. It is about that time. We are at the 5 o'clock hour and our program is nearing an end. And so thank you so much for joining us today. And now we need your help. There are so many people on this briefing. We really can make a difference if we all speak out. So please visit the Take Action Advocacy page on the MHAMD website at mhamd.org. There you will find action alerts on some of the issues that we've been talking about today, including the Behavioral Health System Modernization Act. You can use the action alert to very quickly send an email to your legislator supporting this bill, and just a few minutes of your time really can make a big difference. So please help us out. Also on the homepage at mhamd.org, we have a survey that inquires broadly about issues of importance to you. And we'll be leaving that survey up through the end of this month. So please take a moment to let us know what's important to you and make sure that your voice is informing our advocacy. So thank you again to our sponsors, again, the organizations and all the individual sponsors. Thank you to our speakers. Thank you to the MHAMD board and staff. And most of all, thank you to you. Keep an eye out for more information and action alerts from MHAMD through the rest of the legislative session and beyond into the campaign election season, subsequent campaign and election season. Thank you so much. We appreciate your support and have a good evening.